So if we're going to do this work and do this work effectively, we actually need to go outside of our reach and not just keep engaging with the same singing birds, because otherwise we're just going to get the same song and we're not going to get an understanding around, so what is the lived experience, what are the barriers and issues, and we are never going to get to what is moving forward if the same people are telling us from their lens what moving forward needs to be. We need to be able to listen with our ears, go back to community and go, have I heard you right?
One of those things that we looked at was how can we support local community organisations to go out and undertake community conversations and understand the aspirations of people. Not only does that, is there some authenticity around understanding what communities' aspirations are, but also it actually builds capability in the community and it enables local employment and development and things like that.
We always knew that there was going to have to be a backbone of some sort. And we didn't know what that was going to look and feel like, at this point. One of the things that we did know, though, was you need to invest in a community to demonstrate to them that we are committed to the community. That doesn't mean for us, PHN, to employ someone from the island and go, look how deadly we are, we've employed an islander. It was more about actually going to the community and going, this is what's on offer, this is what we need assistance with.
Once we had an idea of some of the issues and barriers that families were facing on the islands, we then decided as a group that it was really important to go out to community and hold the conversations to just ensure that we had a good understanding of what the issues actually were.
When we went to the community, we initially started using the Harwood Approach by asking the 3 questions. We asked them, what are your hopes and dreams for your family? Some of the wording was aspirations. We found using the words hopes and dreams suited our community better. It was more grassroots and the way we communicate better. What are some of the barriers? And moving forward, what would you like to see on the islands for your kids to improve your family's happiness?
So I think just allowing the time and space for community to be really honest about their feelings is really important, and it has to be done in a way that people feel safe, and because it's like pretty heavy stuff we're talking about, so you've got to have a real, and I think with the SMBI Families group, people feel pretty okay about talking about these things, and there's a sense of trust there.
It probably ended up about a 9-month period. We had over 1,000 interactions with the community. We used a lot of different ways to interact with the community. We went to local PNCs where we did group activities. We went to local organisations and businesses where we did like the local community service centre, the local sports and rec club, where we did group interactions. We used sticky walls where everybody's comments were out there to be heard. We encouraged people to say it how they wanted to say it, not to reword it, not to be somebody that you're not. There's a few F-bombs that slipped out. We made sure we wrote down those F-bombs. We made sure that we weren't rewording people's conversations. And that way we were helping to build that trust, that it's okay to say straight what's happening. You don't have to sugarcoat things.
After we gathered the voices, the hard part of analysing it came into play, because the whole point of our conversations was to capture unedited the voice of our community. So that was a really, really hard task. And Karen and Amy spent weeks trolling through, classifying and subclassifying every conversation to sort it into something that was meaningful. And that actually produced priority areas across all the ages and stages. And the actual conversations held with community, the quotes came out in the foundational report that was produced in July 2019. Things like our slogan, which is nothing about us without us, came out of that. The rest of the report was from the PHN. They gathered statistics and put them all into a document, and it was distributed. But it was a good capture of what's really, really great about our islands and the community spirit, and the statistics that are out there that, show that we need some help.
The Australian Bureau of Statistics stats like the CIFA Index of Disadvantage and other indices are really poor for the islands, and we've known that for quite a while. So we've known the significant disadvantage exists there. Even though those indexes are really bad, it doesn't actually tell you how strong the community itself is. So even though we have a poor set of statistics that say this island's quite disadvantaged, we know that, it doesn't tell the positive side of the story. It's actually, this is quite a strong community that has a lot of really good things going for it and quite a lot of positive attributes going on. So I think this one will lay the foundation data-wise for that. What this family initiative program has done is it's actually ground truthed a whole lot of that data that we're aware of through the eyes of the community itself. So it's let the community tell their own story that actually, in one way it says, there's some disadvantage there, but it also talks about what the positive aspects of the community are as well. So it's putting a very helpful filter onto the data for us. I think the other good thing about bringing all these organisations together is everybody has their own unique data sets, and this opportunity just allows us to bring together some aggregated data. So we're excited about that from a council perspective because, funding needs analysis all live and die on good data. So, if this process, which it does, helps us to get a good data set for the islands, then that actually speeds us along the path as well of getting a better quality response.
It's the foundation report that came out in 2019, had a lot of data that probably opened the eyes of some people. For some people, it was what they already knew, and it gave them a reason to really get in and get this project moving. I think some parts of the community wouldn't have been aware of some of that data, and it's quite eye-opening and confronting that young people maybe aren't doing as well as they should be and could be. We thankfully have a really supportive community though, and I think from that data, it really gives people a drive to do better.
Following on from holding all the community conversations, collating the data, and then as Backbone team, we undertook the task of gathering key stakeholders around our leadership table, and we also, in the background, were empowering all of our SMBI listeners and other community members to be involved in that process, and we identified out of the people that had shown interest and attended meetings previously, 8 people who were key people that were interested in the project and moving forward. We then invited all of those people, if they wanted to share a lived experience at the governance table, and Backbone team members spent a lot of time leading up to that, ensuring that they felt empowered and strong and capable to be brave and stand up and tell their stories. And I actually think at that first leadership meeting, the thing that stood out for everybody there was actually people sharing their lived experiences. And it gave a real context and meaningfulness of what it actually means to live here and raise a family here, because it's kind of like you're not just that number on the page, you're a person with a child, this is your story.
So as a listener, I listen in the community to other people. I'm very organic with that. It just comes naturally to me that I help other mums and that sort of thing. So I think I was already doing that sort of role as a SMBI listener. Now it can be brought to the table that all the stories that I collect as well can be listened to. So I come to meetings when I can, which is great for anyone like me who's busy all the time with their kids and other sort of extracurricular activities. So I can come to the table and share the stories and that sort of thing with the Backbone team, but then I can also go back to my network of mums through playgroup and PNC commitments and that sort of thing, and let them know what's going on with the SMBI listeners and what sort of projects are happening.
Important point to make is that it's We're really wanting, it's no numbers without narrative, so to speak. We're wanting to really ensure that both sources are equally valued. And this is multi-layered then, because I want to ensure that community people, mums and families and dads, and everything, they know that their voice really matters. It's not like we're not wanting to say we're doing this, but on the ground, people are still going, no, this isn't working. We're wanting to make sure that is as valuable as hard numbers.
We always made sure that their voices were reflected back. So yes, these are the numbers, and these are direct statements from community around these priority areas. And we never at any point have kind of put stuff out there without being open to questions about it or physically being there to explain the data. And I think that the other side of the coin, like the government and NGO world, they responded well to it. And I think that that was a huge thing because it hadn't happened before. So those guys, they respond well to data, but we knew community voice needed to be there. So we took the community voice, we created the data set for them to access, and then we're able to present it in a way that I think everybody responded really well to.
So I think SMBI came to CHQ because we already had a presence out there on some of the Bay Islands. So child health services, child health nurses would visit the communities and provide support and assessment services for children in that 0 to 8 age group over in the islands. So we were already there. But I think the difference with this project was, and what really encouraged us to be involved, was the community-driven approach to wanting to improve the health and well-being of children on the islands, and the really strong local commitment to bring together all the different groups of people in the community and services that were visiting the community to look at how we could collectively make a difference to the lives of children. One of the things that really stands out for me in this project is the relationship-based approach. And what's been really important is to build up that level of trust between our clinicians, our services, and the local community.
There needs to be a real shift in people's thinking away from, I guess, that whole old welfare-orientated model of doing business with community to shifting to a mindset of community have their own aspirations, they have their own networks and their own strengths, and it's to me it's about supporting community to to meet those aspirations and goals. So I guess that's sort of really where some of the enabling conditions need to start. It's really an assessment around those two pieces of work. I think it's really difficult to get an initiative like this going if you don't have some level of influence and some level of trust in those relationships with government and sector agencies.
Involving the community, getting the community involved, from a champion's perspective is actually really positive, because it means that, when the funding isn't necessarily there, and look, we hope new funding arises from this initiative, but when the direct funding may not is there, there'll be a community legacy and there'll be empowered champions who can help direct services on the islands over an extended period of time.
At the moment, having spent some time in other place-based approaches in the past, is that I really feel like you've got to, as a backbone, you've got to have some legitimacy in the system space, and then you've got to have that element of deep community connection. The two biggest standouts for me as part of this approach are the level of deep community engagement and building on community aspirations and it being community-led. And not giving lip service to that, actually making sure that that's built into the responses that as a group we're progressing forward. The other part of it is having that real-time action learning, not looking to be going for these arbitrary population level targets. Actually having real-time data and getting your partners on board to supporting the release of that data so that you can actually measure how your progress is going in conjunction with understanding the narrative of the community and seeing whether things are changing.